Now let's go to another Conservative initiative. The Conservative government has vowed to make maternal health a priority at the upcoming G8 summit. But critics say Ottawa's plan has a fatal flaw. It does not deal with birth control and access to safe abortion. Foreign Affairs Minister Lawrence Cannon said the Conservative government will exclude contraception from its plan to help mothers and children in developing countries. But can there truly be an effective program without family planning or birth control programs? Here's how this played out in the House of Commons question period today. Let's listen.
According to the United Nations Population Fund, lack of adequate contraceptive services is responsible for 1.5 million deaths in developing countries every year. Why doesn't this government care about saving the lives of these women and these children?
We have chosen to focus the world's lenses on saving the lives of mothers and children. And Mr. Speaker, when we know what we can do by providing clean water, vaccinations, better nutrition, as well as the most effective way is the training of healthcare workers and improving access for those women, that's what we are going to do.
For more on this, I'm joined by Mike Lake, the Parliamentary Secretary to the Minister of Industry, BC Liberal Keith Martin, and Irene Matheson, the NDP's critic on the status of women. And Irene, let me start with you. You just heard what Minister Otis said today in QP, saying the government is focused on saving the lives of mothers and children. Minister Cannon saying birth control will not be included in its initiative because it says birth control simply doesn't fit in with this notion of saving lives. What's your take on this?
It's absolutely ludicrous. Contraception plays a very, very key role in terms of saving women. We know that 500,000 women and girls die because of complications due to pregnancy. We also know that if there's more space between children, up to 3 years, then women have a much better chance of surviving and looking after their own children. They need access to contraception. I think that this is ideologically driven. It has nothing to do with the reality of what women face in the third world. And if you look at this government, it has systematically eroded the equality of women in this country, and I have absolutely no hope that they have any concern about women, their rights, and their need for protection and support in the developing world.
All right, Keith Martin, you're a doctor. What's your take on how this will affect women's lives? Can you really talk about protecting vulnerable women at the same time in the developing world without dealing with birth control, contraception, and access to safe abortion?
No, the government is actually talking out of both sides of their mouth. On one hand, they're saying they want to help women and children, which is good, and we all support that. On the other hand, they're depriving medical practitioners from having the tools to do the job, preventing women and men from having access to a full array of family planning options, deprives them from having the tools to prevent them from being infected with HIV, sexually transmitted diseases, and having unwanted pregnancies, which actually leads to abortions, which the government is opposed to. So actually by the government preventing people from having access to a full array of family planning options, they're actually destroying the lives of women, preventing people from having the tools to improve their lives and their livelihoods, and also they're enabling children, half of whom will actually die as a result of their mother's demise. More than half of the kids under 5 will actually perish if their mother dies too.
So, Mike Lake, I mean, those are pretty tough allegations you've heard from Irene and Pat. Keith Martin. And the statistics pointing to women's lives being at risk because of pregnancy-related complications. Wouldn't access to birth control or even to safe abortion remedy some of those deaths if saving lives is indeed the priority?
Well, let's take a look at what we're talking about here. We're talking about 500,000 women mothers who will die every year. We're talking about 9 million kids that will die before the age of 5 because of simple things like lack of access to clean water, lack of inoculations, improper nutrition, and lack of proper medical care. What we've done as a government is say we're going to make a priority of addressing this issue that is so needless. What we've heard from experts is that there's been a lot of talk about this over the years, but very little action. What we've tried to do as a government is to take a really focused approach to ensure that we bring as many people to the table, that it can be broadly supported, and that we actually make a difference this time. And that's what this is all about, is taking a focused approach on a specific area to actually make a difference in these people's lives.
But I guess the question here is, Mike, and I'll put this to Irene, when you're saying take a focused approach, can you actually hive off birth controls and safe access to abortion? Irene?
No, the answer is absolutely not. By all means, look at health care and clean water and the things that will help communities to do better, mothers and their children to do better. But you cannot hive off the access to contraception. It's part and parcel. It's a key part. And I think that if you look at the record of this government, it's defunded UNRWA, it's defunded the Canadian Federation for Sexual Health, it's defunded KROS. And a great deal of that is motivated by ideology, because these groups have a different view in terms of all of these issues and in terms of sexual health in regard to contraception and the pivotal role that it plays in giving women some control over their lives, some ability to manage their families and to do better.
All right, so I guess that brings us, Keith, will your party push the government on this issue so that the policy does include birth control and access to safe abortion?
Well, we have been doing that. Mr. Ignatieff, the leader of my party, has been doing that. As soon as the government made their announcement, he said family planning better be right on the table, and the government needs to give people access to the full array of family planning options. What's interesting, Evan, is that a year ago at the G8 summit in 2009, Prime Minister Harper signed on to actually enabling women to have access to a full array, women and men to have access to a full array of family planning options. Now he's saying he's pulling this off the table. And in doing so, he's actually advocating a medical policy, but he's doing it in such a way that violates the basic common ethical practice of medicine, because he's withholding the tools that people need to be able to save their lives, space out their families, save their children's lives. And there's no single intervention that is more cost-effective than investing and enabling women and men to have access to a full array of family planning options.
Mike, I want to leave you with the last word. Paul Wells from Maclean's Magazine posted a blog on this less than an hour ago, saying that other G8 countries like the US and the UK do support a full array of family planning options, which would be the uses of contraception, the uses of access to safe abortion on these issues. In other words, not just focusing in, but taking the full array, which is in accordance with what the United Nations has talked about. So I guess if you're going to introduce this at the G8, Mike, are you going to be in accordance with the policies of the US and Great Britain and other countries?
Of course, those discussions will happen at the G8. What I will address right now is Ms. Matheson's comments about ideology. I think the only ideology at work here right now is a concern for the lives of 500,000 mothers who will die this year because they don't have adequate, clean water and adequate medical care. And 9 million children under the age of 5.
Mike, I just want to be fair. I mean, she's saying that it would be, the ideology would be not the family planning that doesn't include uses of condoms and access to safe abortion. And clearly there is an ideological issue there. Now, maybe the right one or the wrong one, but that's really what she's talking about, to be fair. And so the question is the conservative view on that the thing that's blocking them from including that in this plan?
No, I think what I would say is that we're trying to stay focused on something that can bring people together, not only across this country but around the world, something that everybody can agree on and maintain focus so that we actually get something done this time around. I would make the argument that on the ideological level, it's the other two parties that are trying to throw an ideological wedge into the conversation.
But the G8 leaders did agree to signing off on enabling people to have a full array of family planning options.
Exactly.
Women and men can have access to that here. Why are we depriving women and men from having access to this in other countries? It's completely ridiculous.
The UK wants to include the use of contraception by a third worldwide. If this isn't ideological, I don't know what is.
Right.
Open it to all of the options.
The question, Evan, is do we want to get bogged down in this type of an ideological discussion?
No, we
or do
don't.
we want to actually
open
make
the
a
options.
difference
We do
in the
not
lives
want
of 500,000
ideology driving
mothers
this.
and 9 million
There's
children?
international agreement for this.
All right, the three of you, I know the bells are ringing there. Our audience could hear it in the House. That means there's a vote coming up. up on the Jack Layton's motion about prorogation. I know you've all got to get into that, and we will be taking that live. Mike Lake, Keith Martin, and Irene Matheson. I appreciate all three of you coming in and taking your time out of another busy day. I appreciate that.
Thanks for the opportunity.